Hi, this is Dr. Bhargava. In this short video, I have several interesting cases to share with you. This is our first patient. They were suspected of having endocarditis from prostatic valve infection. And so here are images from their cardiac CT showing the prostatic aortic valve. And then inside that, we see vegetations right there and here. And so this patient had an FDG PET CT scan. Let's take a look at those images, starting with the rotating image. So on this rotating image, we see multifocal intense uptake at the site of the cardiac valve, which is also shown here at the site of the prostatic valve. We see multiple foci of intense uptake consistent with infection. There are some other findings. There is uptake in the esophagus and the stomach from gastritis. Also, the spleen is enlarged. The liver is cirrhotic, and we see a photopenic splenic infarct. So remember, FDG PET CT is good in these situations where a prostatic valve infection is suspected. This is a good article on this topic. This is our next patient, and this patient had a FDG PET CT for staging of rectal cancer. They presented with enlarging lung nodules. And on this rotating image, we see that a nodule in the right lung shows focal hypermetabolism, and there is uptake in the primary, which is seen in the rectum. So let's start with the lung nodule. So this is the nodule that shows FDG avidity. There are other nodules that are not as FDG avid, but they're also metastatic. There is some left lung base atelectasis there showing mild FDG activity. And here are some images from this patient's pelvic MR showing the rectum right here on a T288 axial image. That's the tumor which is invading the prostate right there, right? So it's an advanced tumor. It also involves right here the seminal vesicle on the left side, and the tumor is also seen right there invading the prostate. So MR is the imaging procedure of choice for local staging of rectal malignancies, and we acquire small field of view T2-weighted images in all three different planes. And when there is a concern for metastasis outside the pelvis, then a FDG PET CT scan is helpful for whole body staging. So this patient presented with a history of colon cancer. They had received surgery, and a FDG PET CT scan was performed to evaluate the finding of ctDNA positivity on their blood tests. Let's start by looking at the rotating image. We see focal hypermetabolism in the right lobe of the liver. This focus corresponds to this finding seen on the fused image. And this patient also had a diagnostic CT abdomen and pelvis, which shows this hypodensity in the right lobe consistent with metastatic disease. So this patient has metastatic colon cancer, and this FDG PET CT was initiated because of the positive ctDNA. ctDNA stands for circulating tumor DNA. It's a non-invasive test for detection of DNA fragments shed by tumor cells in the bloodstream, and the test uses either PCR, like polymerase chain reaction, or NGS, which is next generation sequencing. This is also called liquid biopsy. When the test is positive, it suggests that there may be residual disease, high risk of recurrence, or recurrent disease. This is more sensitive than the CEA, and it is useful for guiding adjuvant chemotherapy, and the positive test is an indicator of worse outcome. The important thing to know about ctDNA is that it detects actionable mutations such as KRAS, NRAS, or BRAF. It guides targeted therapies in clinical trials and tracks resistant mutations during treatment. Here's our next patient. This patient was diagnosed with a duodenal neuroendocrine tumor, and we performed a duodenal PET CT. Let's start by reviewing their rotating image. So we see physiologic uptake in the pituitary, which is characteristic of dotatate. Right there, we see intense uptake in the spleen compared to the liver. Liver is markedly enlarged, and here are some axial images showing a stent in the duodenum. The tumor was obstructing. You can see abnormal density there. It is not dotatate avid. Look at the liver. This is very interesting because this tumor does not express somatostatin receptors. We see these hypodensities on the CT part of the PET CT, and the fused images show that there is no increased uptake of the radiopharmaceutical in these liver mets. So this is a high-grade tumor which is negative on dotatate PET CT. There are some foci of metastatic disease which show some somatostatin receptor expression and some uptake, like this focus in the right proximal femur and this soft tissue or focus in the subcutaneous soft tissues. Here is a good review article on neuroendocrine tumor diagnosis and management using gallium-68 dotatate PET CT. Thank you for watching.